Hello everyone, my name is Jeffrey Thibodeau. I'm a physical therapist and owner of Empower Physical Therapy and Consulting. We are based out of Greater Portland area of Maine, and I wanted to talk a little bit today about elbow and forearm pain. Golf season coming up, we got a lot of people playing pickleball indoors and pretty soon tennis and pickleball outdoor. And on my caseload specifically, I'm seeing a lot of people develop some tendonitis in their elbow and forearm area. Many of you, I'm sure, have heard of golfer's elbow or tennis elbow. So when we refer to what's called tennis elbow, that's on the outside of the forearm elbow area, also referred to as lateral epicondylitis. And on the inside of the forearm is what we call golfer's elbow or medial epicondylitis. I wanted to talk a little bit today about things that I do in physical therapy to help get people out of this pain cycle. As we know, tendonitis can be a really stubborn injury, and if we ignore it and just think it's going to get better, that's when it becomes a chronic issue, and it takes a lot longer to go away. So if you start to feel some of these symptoms that I'm going to talk about, seek out some physical therapy. Feel free to reach out to us on our website. I'd be happy to do a free discovery call with you to discuss how we can help you with your pain. And in the next video, I'm going to also show some examples of some exercises that you can start at home, and that should help get the ball rolling for you. So when we start talking about symptoms that are related to golfers or tennis elbow, many people describe symptoms such as having pain when they pick something up, like a coffee cup or a bottle of water, pain when squeezing, pain when shaking hands, or pain when doing activities such as golf, tennis, or pickleball. When we start referring to that pain, it can be sometimes achy or sharp, and at times people even describe dropping things when the pain gets bad enough. Pain with using a screwdriver or a hammer are often associated with these types of injuries. And these injuries can be a few things. Often it's repetitive injury from overuse, and then other times it's compensatory pain. And what I mean by that is when I evaluate someone with elbow pain, I'm always going to look at shoulder strength, neck and upper back mobility, and assess whether or not they have some muscle imbalances or tightness somewhere that leads them to overusing the muscles in the forearm and elbow. So if you are feeling some of these symptoms or you have pain on either side of your elbow that are nagging you, like I said, the sooner you can get to a PT, the better. So a few things that we do to try to create a better healing cycle, agitate the tissue, and promote blood flow are these three things here. So I have dry needling. I've been dry needling for about 7 or 8 years. And this is a point stim unit. So when we do the dry needling, we'll put the needles into the muscle tissue. We use the point stimulator to get that muscle firing. That helps to create a new signal to the central nervous system and get that muscle out of its dysfunction. So dry needling is one thing that we do use. We don't always have to use that. The next thing I'll show you, this is just a gua sha tool. You can get these on Amazon for $12 or so, maybe even a little less than that. But any type of instrument to do instrument-assisted soft tissue massage. I tend to use Free Up for my emollient on the skin. Basically, when we do this, we take that instrument and we go in multiple directions in that muscle group that attaches to the bone that's causing the pain from the tendonitis. This is a very effective way to start this on your own. Just make sure you know how to do it. So again, feel free to reach out to us if you have any questions about that. But that's kind of a gold standard, easy thing to do. And then kind of the top notch, what I'm really excited about and have had a ton of success with is radial shockwave therapy. The unit we have is from Portland Health Supply Company. They're fantastic. This unit is amazing. So the radial shockwave uses technology that creates acoustic waves that penetrate the tissue, and they create a healing cycle. I am going to put out a video specifically on shockwave because there's a lot to the technology. I don't want to bore you with that right now, but basically we use this to create some agitation in the tissue. So we would put on our settings and then put a little ultrasound gel on, and that goes on the area, and we start some treatment. The treatment can be slightly uncomfortable when you have it done, but it is definitely something that I've seen become the most effective at reducing how long it takes to get out of the pain cycle from tendonitis. And this is definitely something that not everybody uses or not everybody has, and I would love to talk to you about that if you're having any issues. So look for our next video. We're going to talk about some exercises you can start doing at home that are really good for tendonitis symptoms, and I look forward to hearing from you all. Thank you.